enter the room.
Hello, my name is Basant Sharqawi. My GMC number is 123456. I can see my patient is attached to the monitor. I assume I've taken all universal precaution. John Peter. Hello.
Hello.
Hello, I'm Dr. Basant. I'm one of the doctors working here. Could you confirm your age, please?
Yeah, I'm 48.
All right. I understand that you had a fracture and you are taking some medication, morphine, isn't it?
Yeah, doctor, but I'm feeling dizzy, doctor.
Yeah, I can see you are feeling dizzy. And do you have anything else apart from feeling dizzy?
Yeah, a little bit short of breath, doctor.
Could you tell me more about that?
Yeah, just started today's morning all of a sudden.
All of a sudden, okay. And have you noticed anything makes it better?
No.
Anything makes it worse?
No.
It is the first time to happen?
Yes, doctor.
And anything specific happened before that?
No.
Okay. Do you have any fever?
No.
Any chest pain?
No.
Any leg pain by any chance?
No, I'm just dizzy, doctor. Please help me.
I'll help you. Could you bear with me? But apart from this, do you have any medical condition?
I'm having some medical problems, kidney and high blood pressure.
All right.
Yeah.
And are you taking any medication for that?
Yeah, doctor.
Do you remember the names?
No.
Okay. Do you have any allergies?
No.
Okay. I'll follow ABCD assessment. It's kind of head-to-toe examination to find out what is going on with you. Okay?
Okay.
As my patient is talking, the airway is patent. I'll have a look at the monitor. I can see the oxygen saturation is low and respiratory rate is low. So do you have COPD or smoker cough?
No.
Okay, I'll give my patient oxygen. I'll give you oxygen to help you with breathing. I'll give my patients 15 liters a minute oxygen by another breather mask. This should help you with breathing, Mr. Peter. Okay, I'd like at the moment to examine your chest. I'll maintain your privacy. Have a chair with me. It will involve me look, listen, feel, and tap over your chest. Okay, Mr. Peter. Mr. Peter, my patient is not responding, so at the moment I'll call for help. I'll do head tilt and chin lift. I'll maintain the airway patent by inserting nasopharyngeal airway, and I'll check. As my patient is on morphine and respiratory rate was low and oxygen saturation was low, so at the moment I'm suspecting morphine overdose. I'd like to check for pupils.
His pupil is 1 millimeter.
1 millimeter, which is narrowed pupils, pinpoint pupil. So I'm suspecting morphine overdose. At the moment, I'd like to give my patient naloxone, so I'll insert cannula. I'll give my patient 0.4 milligram naloxone. It should be repeated if the patient is not responding to this after 2 to 3 minutes.
Oh.
Mr. Peter.
Oh, what's happened?
You actually was unresponsive for a while. Mr. Peter, have you changed it in your morphine dose recently?
No.
Okay. I'd like to examine your chest. It will involve me look, listen, feel, and tap over your chest. And maintain your privacy. Have a chair with me, okay?
Okay, no problem.
I'll expose you. By an inspection, I can appreciate the breathing rate is quite low. Central trachea. I'll tap over your chest.
Okay.
I'll listen to your chest. I can appreciate bradypnea or low respiratory rate. At the moment, I'll ask for ECG, X-ray, and APG. I'll move to C part. I can check the vitals. Oxygen saturation is getting better. Heart rate is normal, and blood pressure normal, and also respiratory rate. At the moment, I'd like to check blood pulses and also perfusion. I'll press over your thumb. Wait, bear with me, please. I'd like to listen to the heart. I'd like to listen to your heart.
Okay.
Okay. I'll check your pupils again. I'll shine light into your eyes, okay?
Okay. Pupil right now is 4 millimeters.
So the pupil are active and normal. I'll measure your sugar level. And I'll measure your temperature.
Is 36.9.
The temperature normal. Mr. Peter, could you...
2 minutes remaining.
Thank you. Hello, I'm Basant Sharkawi. I'm 1FFY2 in the emergency department. I have a patient, John Peter, 48-year-old man, came complaining of shortness of breath and feeling dizzy. The patient had back fracture and he was taking morphine for that. I assessed my patient. I found that the oxygen saturation was low and respiratory rate was low, and also he had pinpoint pupil. So I'm suspecting morphine overdose. So I give my patient naloxone 0.4 milligram, and I put the patient on oxygen 15 liters per minute binaural breather mask. And the patient get improved respiratory rate, and oxygen saturation was coming back to normal. So at the moment, we will keep the patient admitted, and also we will do toxicology screening and routine blood test, liver function test, and kidney function test to make sure that the patient will be all right. And we will educate the patient about the dose of morphine and to keep a diary for morphine doses. And also we can educate the carer about that. And we can educate the patient about the morphine overdose symptoms and how to inject himself. And also we can educate the carer about that, about injecting the patient with naloxone if suspecting morphine overdose.